Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Sjogren Syndrome. Introduction. Sjogren Syndrome is a disease that causes dryness in your mouth and eyes. It can also lead to dryness in other places that need moisture, such as your nose, throat, and skin. Most people who get Sjogren Syndrome are older than 40. 9 out of 10 are women. This program explains Sjogren Syndrome. It discusses its causes, symptoms, diagnosis, and treatment. Sjogren Syndrome. Sjogren Syndrome is a disease that affects the glands that make moisture. It most often causes dryness in the mouth and eyes. Sjogren Syndrome can also lead to dryness in other places that need moisture, such as the nose, throat, and skin. Sjogren Syndrome is sometimes linked to problems with bones or muscles, such as rheumatoid arthritis. Like rheumatoid arthritis, Sjogren Syndrome is an autoimmune disease. Your immune system is supposed to fight disease. If you have an autoimmune disease, your immune system mistakenly attacks parts of your own body. Most people with Sjogren Syndrome are able to live normal lives with very few adjustments. A great deal of attention must be given to dealing with dry eyes and dry mouth, but these symptoms often go away with time. Symptoms. The main symptoms of Sjogren Syndrome are dry eyes, dry mouth. Sjogren Syndrome can also affect other parts of the body. This includes the skin, joints, lungs, kidneys, blood vessels, digestive organs, and nerves. When other parts of the body are affected, symptoms may include dry skin, chronic dry cough, joint and muscle pain, numbness and tingling in the arms and legs, skin rashes, thyroid problems, vaginal dryness. Sjogren Syndrome can also make you very tired. It can damage important organs of the body. Some people may experience only the mild symptoms of dry eyes and mouth. Others may go through cycles of good health followed by severe disease. You should see a healthcare provider for any pain or redness in the eyes right away. This may be a sign of an infection. Saliva helps keep your mouth healthy. Because Sjogren reduces the amount of saliva in the mouth, you have a higher risk of dental problems. To reduce the risk for cavities and other dental problems, pay close attention to proper oral hygiene and regular dental care. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Complications. People with Sjogren Syndrome may develop serious complications. They include the following: lymphoma, or cancer of the lymphatic system; infection of the parotid glands, the glands along the side of the jaw; tumors in the parotid glands. Lymphoma is cancer of the lymphatic system. This system plays an important role in keeping the body healthy. Some research has shown that the risk of developing lymphoma is higher in people with Sjogren Syndrome than in the general population. Symptoms of lymphoma may include a large mass or swelling in the neck, under an arm, or in the groin; pain, numbness, or tingling in an arm or leg; fatigue; unexplained fevers or night sweats; unexplained weight loss. See your healthcare provider if you have any of these symptoms. Infection of the glands lining the side of the jaw, known as parotid glands, usually causes swelling, pain, redness, and warmth on one side of the face. Heat and massage along the jawline can help and may prevent this complication. Another complication of Sjogren Syndrome is parotid tumors. When this happens, the parotid glands become enlarged and unusually hard. There is also a risk of complications to a pregnancy. Children born to women with Sjogren syndrome have greater than normal risks for newborn lupus and congenital heart block. Not every child born to a mother with Sjogren syndrome will develop these problems. Causes. Sjogren syndrome is an autoimmune disease. The immune system is supposed to fight disease by killing off harmful viruses and bacteria. But with autoimmune diseases, your immune system attacks parts of your own body by mistake. In Sjogren syndrome, your immune system attacks certain glands. Glands are organs that make one or more substances, such as hormones, digestive juices, sweat, tears, saliva, or milk. Some glands open to areas inside of the body. Some glands open to areas outside of the body. The glands affected by Sjogren syndrome make tears and saliva or spit. Sjogren syndrome may also affect your joints, lungs, kidneys, blood vessels, digestive organs, and nerves. Healthcare providers don't know the exact cause of Sjogren syndrome. They think it may be caused by a combination of two things: genes, or the genetic material passed from parent to offspring; exposure to something like a virus or bacteria. Risk factors. Although healthcare providers are uncertain about the exact cause of Sjogren syndrome, they have found certain factors that increase a person's risk for getting the disease. These are known as risk factors. Women are 9 times more likely to have Sjogren syndrome than men. This means that being female is a risk factor for Sjogren syndrome. Age is another risk factor for Sjogren syndrome. Most people are more than 40 years old at the time of diagnosis. Sjogren syndrome sometimes develops as a complication of another autoimmune disorder. This is known as secondary Sjogren's. People with autoimmune disorders have a greater risk of developing Sjogren's. Not every person with a risk factor for Sjogren's will develop the disease. It is also possible for people with no risk factors to develop Sjogren syndrome. Diagnosis. Your healthcare provider will first ask about your medical history and symptoms. A physical exam also will be performed. Blood tests may also be done. A blood sample is taken and examined for evidence of Sjogren syndrome by measuring specific substances in the blood. Eye and mouth tests can be helpful in diagnosing Sjogren syndrome. Some of these tests measure the amount of tears in the eyes or saliva in the mouth. Other tests look for damage associated with Sjogren syndrome. Diagnosing Sjogren syndrome may involve certain imaging tests. For example, a sialogram is a special X-ray that looks at the glands that produce saliva. A dye is injected into glands behind your jaw and in front of your ears. The test measures how much saliva is produced. A salivary scintigraphy is another imaging test that measures how well the glands that produce saliva are working. For this test, a small, safe amount of a radioactive substance is injected. A chest X-ray may be done. It can show if the lungs are inflamed due to Sjogren syndrome. To see if Sjogren syndrome has affected the kidneys, a urine sample may be collected and tested. A biopsy of the lip can be helpful in diagnosing Sjogren syndrome. For this test, a small piece of tissue is removed from the saliva-producing glands in your lip. The sample is then examined under a microscope to see if the cells are inflamed. Treatment. There is no known cure for Sjogren syndrome, nor is there a specific treatment to restore gland secretion. Treatment may be different for each person. It depends on what parts of the body are affected. Treatment often focuses on getting rid of symptoms. Supportive care can help a person with Sjogren's feel more comfortable and improve his or her quality of life. Treatment may include medicines for joint or muscle pain, such as aspirin and ibuprofen, that help you make more saliva, that suppress inflammation, such as corticosteroids, that suppress the immune system. Treatment for dry eyes may include eye drops and ointments, medicines to reduce inflammation in the eye, a chemical that wets the surface of the eye and keeps the natural tears from drying out so fast, surgery to shut the tear ducts that drain tears from the eye. Treatment for dry mouth may include chewing sugar-free gum or sucking on sugar-free hard candy, sipping water or a sugar-free drink often to wet your mouth. using a saliva substitute prescribed by a healthcare provider to make the mouth feel wet, using medicine to help your mouth make more saliva. People with dry mouth can easily get mouth infections. Tell your healthcare provider if you have white patches or red burning areas in your mouth. Sometimes symptoms improve with supportive care, but some people may not respond to supportive care and continue to cope with blurred vision, constant eye discomfort, recurrent mouth infections, swollen parotid glands, hoarseness, and difficulty in swallowing and eating. Some medicines can cause eye and mouth dryness. Medications may need to be adjusted.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Sjogren syndrome is a disease that causes dryness in your mouth and eyes. It can also lead to dryness in other places that need moisture, such as your nose, throat, and skin. Most people who get Sjogren syndrome are older than 40. 9 out of 10 are women. Sjogren syndrome is sometimes linked to rheumatic problems such as rheumatoid arthritis. Like rheumatoid arthritis, Sjogren syndrome is an autoimmune disease. If you have an autoimmune disease, your immune system, which is supposed to fight disease, mistakenly attacks parts of your own body. The main symptoms of Sjogren syndrome are dry eyes and dry mouth. Sjogren syndrome also can affect other parts of the body, including the skin, joints, lungs, kidneys, blood vessels, digestive organs, and nerves. If this happens, symptoms may include skin rashes, vaginal dryness, and other problems. Healthcare providers don't know the exact cause of Sjogren syndrome. They think it may be caused by a combination of genetic material passed from a parent to an unborn child and exposure to something like a virus or bacteria. There is no known cure for Sjogren syndrome, nor is there a specific treatment to restore gland secretion. Treatment differs for each person. It depends on what parts of the body are affected. For example, dry eyes may be treated with eye drops or eye ointments. Treatment often improves your quality of life. Thank you for using Explain.